Hello, I'm Dr. Pelto, and in this episode of Healthy Living, we're going to focus on practical tips for a healthier life as a diabetic. Let's get started and talk about a few simple ways you can prevent getting a foot wound. You may not know, but just because you have diabetes, you have a greater risk of developing a foot wound, also known as an ulceration. Wounds of this kind typically begin as a blister on the bottom of your foot or between your toes. They can become infected, and if the infection is serious, lead to losing a portion of your toe or even your leg. Here are the easiest and most effective ways you can prevent an ulceration. To start, I cannot emphasize enough the importance of self-examination of your feet, both the tops and the bottoms and between your toes. A mirror can be very helpful, but if you're unable to see all aspects of your feet, it's best to have a loved one help. For those that are high-tech, I've seen my patients use an iPad and they take it and place it on the floor and then they make a video recording to see if they have any problems on their feet. Anything you find that appears abnormal or strange looking should be evaluated by a professional, such as dampness between the toes, blistering, a new callus, an area of redness, ingrown toenail, or cut or scrape. Even if you see your podiatrist only every 2 to 3 months, it's recommended to go see them sooner if you have anything that's of concern on your foot evaluation. Next, we're going to talk about what you should wear on your feet as a diabetic. Specific shoes that are extra depth are specially designed to help diabetics avoid ulcers, which, as we've seen, can lead to very serious medical problems. Medicare and most insurances provide coverage for these kinds of shoes. For insurance companies, this coverage of giving people shoes can save them thousands of dollars that treatment of an ulceration can ultimately cost. And an amputation? Well, that's 10 to 20,000 times more expensive than treating the wound in the first place. So who can get diabetic shoes? Generally, diabetes by itself isn't enough. You have to have one of these things we call risk factors that make you at higher risk of an ulceration. Let's look at these dangerous risk factors. The first thing, you may have swelling or a lack of a pulse in your feet can be a sign of poor circulation. Here's a simple test. Press on the tip of your big toe, and if the spot where you pressed becomes white or blanches and then the red quickly returns, your circulation is probably normal. If you're unsure how your circulation is, it's good to go to a podiatrist who will evaluate your pulses. There are 2 main pulses on your foot. One is found on the top of the foot, called the dorsalis pedis artery, and the other one is found behind on the inside of your ankle, called the posterior tibial artery. If your pulses cannot be felt on your feet, you may need a more specialized exam by a physician. In our office, we use a device called a Doppler to help us listen to the flow in the blood vessel. Here is an example of the sound of a Doppler. If the sound of the blood flow is good, it's going to sound like a swishing sound. If the blood flow cannot be heard, there is another test that can be done that uses blood pressure cuffs of different areas of your leg to determine the flow of your blood. Another reason that diabetic shoes are covered for you is if you have a foot deformity. No one likes being considered deformed, but this is merely a technical term for any type of foot or bone abnormality that could cause rubbing in your shoe. This can cause blistering and lead to very serious problems. Extra depth or diabetic shoes can help. The common bony prominences are called bunions, as you can see in this picture, and also the toe next to it, the second toe, has a hammer toe. Other problems can include a longer toe, a collapsed foot, and these deformities generally are sufficient for insurance to pay for a diabetic shoe for many people. Something else to look at is your sense of feeling or touch on the bottom. If it's compromised, you're at greater risk for stepping on an object that can penetrate your skin. This issue of poor feeling is called neuropathy. Some people with this neuropathy don't have any pain, but others had a lot of pain in their feet and their legs. Now, however, if you have neuropathy, you have some reduced sensation, and you may not know that you're scuffing the bottoms of your feet, which can produce a callus or a wound without knowing it. We can test the feeling of your feet using a little plastic device called a 10-gram monofilament. Here's an example of this little device. This is a thin plastic wire where you gently poke on areas of the bottom of each foot. And if you're unable to feel these pokes in uncalloused areas of your skin, you probably have some level of neuropathy or poor feeling, which qualifies you to obtain diabetic shoes. Also, if you've ever had a wound or ever needed a partial amputation of a toe, you are at greater risk for developing other problems in the future. This probably indicates that you have some or all of the conditions that we mentioned previously. Usually a foot wound is not caused by one isolated problem, but rather a combination of problems that led to a wound or an amputation. These are the top health risks that qualify you for diabetic shoes. Other factors can be involved, but most people who have these conditions would qualify for diabetic shoes. Finally, I want to talk to you about calluses on your feet. If you develop a callus on the bottom of your foot or on the sides of your toes, it can develop into a wound quite easily. The proper treatment for calluses is trimming them with a specialized instrument. This should never be done at home on your own. Only a podiatrist should trim your calluses. For mild calluses on the bottom of your foot, specialized callus creams and pumice stones can help. A word of warning, do not use callus removers. They contain a strong acid, and the acid is not able to determine what is normal skin or what's thickened callus skin, and it can't determine how deep to penetrate in your skin. If you have poor blood flow or poor feeling and use these treatments, they very commonly cause wounds. Instead, a lighter and safer cream is available that can reduce some of the calluses. But if the calluses seem to be getting thicker, consult your podiatrist about proper treatment. If you would like more information on taking care of your feet with diabetes, please visit drpelto.com and click the link for healthy living, and you're going to find more resources there on diabetes.